we're here promoting awareness.
There we go. You want a keychain? Sorry.
Today we're here promoting awareness about sickle cell and sickle cell trait.
Okay.
Did you know if you had the trait or?
No, I have no idea.
Okay. Well, if you were born in the United States after the year 1990, you've been tested for it.
Okay.
So with your newborn screening. But basically, it's a genetic disease passed on from your parents. Your normal red blood cells, they're a nice donut shape right here.
Okay.
When you have the trait or you have the full-blown sickle cell anemia, you have a sickled shape. So the sickled cells, as you can see here, are getting stuck. They have the abnormal misshape, and they're getting stuck together, which cuts off your oxygen supply and your blood flow to various parts of your body because you don't have the adequate blood flow through the vessels. So it's especially important if you're an athlete because of something called rhabdomyolysis. Have you heard of rhabdomyolysis?
No, I have not.
Okay. That's okay. Rhabdomyolysis can be caused by direct or indirect muscle injury, and what happens with it is your muscles start to die off. So the fibers release toxins into your bloodstream. When your kidneys try to filter that out of the blood, your kidneys can start to fail. So it causes renal failure, which can ultimately lead to death. So with rhabdomyolysis and a sickle cell trait, you want to be especially aware of adequate hydration. You're going to have, if you have the rhabdomyolysis happening, you're going to have symptoms like muscle pain, muscle weakness, decreased urine output. Your urine can be red or brown, fever, confusion, dehydration, rapid heart rate, all these symptoms.
That's scary.
It is scary. And what's really scary about it is if you don't know your trait status or if you don't know that you have the disease, you can actually just attribute all of those to normal physiological responses from overexertion. So you just want to make sure and stay adequately hydrated, and you also want to make sure that if you are experiencing any of those symptoms that you stop and rest.
Okay.
Stop and rest and make sure you drink a lot of water.
So,
Hey, my name's Kendall. How are you?
Good, Natasha. Nice to meet you.
Hi. Have you heard of sickle cell?
I've heard of it, not quite sure what it is.
Okay. Well, today we're doing some teaching for the Tova Community Health Center on sickle cell, and a lot of people aren't aware what it is. So we're doing teaching because it is very important. It is a disease. It's a genetic disease where your red blood cells are actually sickle shaped, so like a crescent.
Okay.
And it makes it hard for the red blood cells to flow through the veins and arteries. So it can cause extreme pain, and also you're not getting oxygen to parts of your body and all the tissues and organs that you need. So yeah, it can be really painful.
Yeah.
And it's important to get tested.
Okay.
There is a Tova Community Health is located in Wilmington, Delaware, and it is a place where you can get screened, and you can also get all of your care that you need. It's coordinated so that you can have a doctor who's following you and know everything about you. And here it is. Here's the card. Dr. Nina Anderson is in charge of the clinic.
Okay.
And they have a 5K every year. This year it's on September 5th.
Okay.
And it's good to come out because it spreads awareness for the trait, whether you have it or your family members have it, or anyone that you know might have it.
Okay. A question. People living with sickle cell, like what's kind of like their daily lifestyle? Like, can you live long with sickle cell disease?
You can live very long as long as that you manage it. So it's very important to get screened, and make sure that you're aware that you have it so you can manage it. There are some easy ways to manage it. One of the big ones is make sure that you get oxygen. So if you live in a high altitude, which luckily in Delaware we don't, but you want to make sure that you get oxygen and stay well rested and well hydrated. Hydration is key when you have sickle cell.
Natasha.
Hi, Natasha.
Nice to meet you.
Welcome to our booth. We're talking today about sickle cell trait, and I'm going to first. I want to see if you have. Are you familiar with sickle cell?
No, not really.
Okay. You know if you've ever been tested for it before?
Not sure.
You're not sure?
Yeah.
Okay. Let me see. Let me grab this sheet here, and I'm going to ask you some questions.
Okay.
So you've heard of the disease before?
I've heard of it, yes.
Okay. But you're not sure if any family members have it?
Not sure.
Okay. Are you an athlete?
I was.
You
Not
were?
anymore. I mean, I still exercise. And so,
Okay.
Yeah.
Okay. Are you diabetic?
No.
No. Okay. Are you planning on having any children, or do you have any children?
Don't have children, but down the road.
Down the road? Long time?
Right.
Okay. Are you familiar with rhabdomyolysis?
No, not at all.
Okay. Well, we can talk to you about that, get you educated on it and the effects of it if you were to have the trait or to have the disease. So you don't know if you've been screened before. Okay, perfect. So if you were, I'll tell you a little bit about sickle cell. If you were to have the trait or to have the disease, then you would want to be screened with genetic counseling before you and your mate before you were to have babies.
Okay.
Because if you have the trait or if you have the disease or your partner does, you'd be at more higher risk of transferring it to the baby.
Okay.
So pretty much what sickle cell is that your normal red blood cells are round, so they can easily flow through your veins. However, when you have the trait or you have the disease, they become sickled in such that they kind of are like a half moon. There's actually a picture somewhere. Where'd the picture go? Oh, here we go. So as you can see here, it would get occluded. So the occlusion prevents the blood and the oxygen from getting through, which can be very painful, which is what ends up being called sickle cell crisis.
Right.
So you need massive hydration to keep the blood flow going through, and you would also need, if you were to go into sickle cell crisis, you could end up needing to get hospitalized, and you may need some IV pain medication to help get you through the pain, get you over the hump, and get that massive hydration, which is why I asked you if you were an athlete, because that would be huge, because if you are not aware that you have it, and you're doing extreme workouts or basketball or some kind of, and all of a sudden, you pass out, and your coach and your co-teammates don't know what's going on, they would think that, she's just, it's a little lightheaded, or she worked it too hard. That's not the case. The case is that you went it, you prevented all the blood flow prevented from getting through here because you're dehydrated. So hydration is key.
Hey, how are you? Good. My name is Cheryl, and I'm a student here at Del Tech. And what we're doing today is we're educating everyone in regards to sickle cell and sickle cell trait, especially if you're an athlete. Are you an athlete?
I used to be an athlete.
You used to be an athlete? That's good. And one of the most important things that I will tell any athlete is to get tested for the sickle cell trait or the sickle cell disease. And why? Because in the past 9 years, we had 11 athletes die. Because they had the trait and no one was aware of it.
Okay.
So one of the things that happens when you have the trait is called sickling. Your cells sickle. And these are normal hemoglobin cells. This is what a normal hemoglobin cell looks like. It's round, it's plump, it's juicy, it's red, and it's moving through your body the way it's supposed to. But what happens is, as an athlete, if you have the sickle cell trait, by you being you're exhausted, you're working out your muscles and everything, and you're getting exhausted. So what happens is, if you don't get enough fluids into your body, that this perfectly round sickle cell perfectly round hemoglobin turns into a C shape.
Oh, okay.
And what happens when it turns into a C shape, you'll have more than one that turns into a C shape, and they all sickle together.
Okay.
And then they clot. And it blocks the blood flow of your regular hemoglobin. So it's very important to keep hydrated. And also, the number one thing that I can ask any athlete to do is get tested. Have you ever been tested for sickle cell?
No, I haven't, but I do have a question.
Yes.
So, like I said, I wasn't an athlete, but I do occasionally like to run. So would you even suggest this for somebody who's
Absolutely.
wants to work out?
Absolutely.
Or, okay.
Because what happens is you're exerting. And when you're exerting, what are you doing? You're sweating.
Right.
And when you're sweating, you're losing fluids. So you're losing fluids from your body.
Okay.
So if you're not putting the right amount of fluids back into your body, what happens? If you have that trait, you're going to begin to sickle. Right? And you're going to get exhausted. And it's called exhausted sickling. You're going to sickle, and it's called exertional sickling is what takes place. Okay. So, do you mind filling out this for us?
Sure.
And we have an
This?
yes, fill that out for me. We have a community doctor. Her name is Dr. Nina Anderson.
Okay.
And what she does is she's going to reach out to you and she's going to contact you in regards to getting tested for sickle cell and the importance of it.
Okay.
She's going to reinforce the teaching that we've taught here. And it's just very important that you get tested for that.
Okay.
And can you fill out this for me as well? Thank you.
Okay.
And this right here, this is the pamphlet right here that talks about all the different types of hemoglobins that happen in our body. Like everyone should be A. A is perfect. There's nothing wrong.
Right.
But there's a C and there's a few other ones that you really need to read up on.
Okay.
And here's also a community pamphlet for TOVA. This is the community health center that handles the sickle cell in this area.
Okay.
And it's important, so if you have any questions, it talks about the disease, it talks about exercising and training, it talks about how you get the disease, because it is a genetic disease, and that one of your parents, for you to have the trait, one of your parents would have had to give it to you, so they have the trait.
Right.
So what happens is it tells you exactly how you're going to get the disease. Or whatever, and also tells you how to keep yourself hydrated and the importance of it.
Does TOVA have any Facebook page or anything I can go
TOVA
to?
does have a Facebook page.
Okay.
So if you go just type in TOVA Community Health Center on Facebook, it'll bring up all that information. You may even it'll bring all the information. You may even see some videos of people who have learned about it and got tested, and also people who are living with it.
Okay.
Like myself, I have sickle cell trait. So I just keep hydrated.
Yeah. Keep hydrated.
Keep hydrated.
Right.
Hydration is the most important thing.
Okay.
Okay.